Long time no see. This is YouTube Medical University. Let me start by talking a little about my outpatient clinic. There was a fisherman in his 80s I used to see during home visits. He said this, "Doctor, I want to spend my final days in the home I've lived in for so long. If possible, I'd like to see my grandchild's graduation ceremony." These two wishes expressed his feelings much more eloquently than the questions we often hear in medical settings. Today's theme is not about how to die. This video is about how to live true to yourself until the very end, and it's for families who support their loved ones in living true to themselves. There's some data here that I want everyone to know about. Have you ever heard the term pinpin karori? It means staying healthy right up until the moment you pass away and then going quickly at the end. Many people consider this to be the ideal way to go. However, a study conducted at a certain Japanese university reported that only about 3% of people actually pass away in this pinpin karori way. That's what the report says. There is some variation depending on the study, but even at the highest estimate, only about 10% of people pass away in this way. In other words, the reality is that 90% of people need someone's help at some point before they pass away, rather than dying in that pinpin karori way. And one more thing, the difference between healthy life expectancy and overall life expectancy in Japan is about 8.5 years for men and about 11.6 years for women. The life in healthy life expectancy and overall life expectancy means that healthy life expectancy is the period you can live independently without anyone's help. After that comes the rest of your lifespan. In other words, this difference is the period of time when you live while relying on someone else's help. This difference is about 10 years. And this roughly 10-year gap has not narrowed at all in the past 20 years. Even as medical care advances, and especially because of these advances, people may still need caregiving. The amount of time people can live has increased. In other words, everyone will spend about 10 years living with the help of others. And maybe everyone will also experience about 10 years supporting someone important to them. There is only one absolute truth in medicine. What is it? That everyone will eventually pass away. No matter how wealthy or famous someone is, this fact does not change. However, there is an interesting fact. Only about 3% of people have had detailed discussions with their families about end-of-life medical care. And there is something called advanced care planning, where people discuss the end of life, but about 95% of people either don't know much about it or don't know about it at all. The person probably doesn't want that kind of treatment because they didn't tell us their wishes. The family ends up troubled. Things like this are still happening in medical settings today. Hello, I'm Dr. Mandarin from YouTube Medical University. So today's topic was something that took a bit of courage to talk about. I'll be talking about the signs that appear before someone passes away and the things that families often do with good intentions but are actually counterproductive. Should you keep IV drips going until the very end? What should you do if the person's throat rattles? Trying to learn all this last minute can be overwhelming. Let's learn together, based on medical facts, about the correct ways to provide care and what happens to the body before someone passes away. If you watch this video until the end, when you are with your loved one in their final moments, it will make a difference in how peaceful that time can be. Please be sure to watch until the end. Also, at the end of this video, I will introduce the single most important question that I always ask in my clinic before thinking about the end of life, something you should ask and consider for yourself. For those who feel it's bad luck or uncomfortable to talk about how they want to die and find it hard to discuss such topics, I believe this will be helpful, so please make sure to watch until the end. So here's today's agenda. First, in the first section, I'll briefly explain why I want you to hear about this now. If you're interested in the main topic, start watching from section 2. In the second section, I'll introduce 6 signs that appear before someone passes away. And in the third section, I'll talk about how to have conversations with your family, starting from how you want to live. Let me share an important data point. A study conducted in the United States found that among people over the age of 65 for whom a medical decision had to be made near the end of life, about 70% were no longer able to express their wishes themselves at that point. 70%, so about 7 out of 10 people. when it comes time to make an important medical decision, are already in a state where they can't express their wishes. They want to spend their final moments at home. They don't want life-prolonging treatment. That's the one thing they want to communicate. But even if they feel that way, when the time comes, most people can't say it anymore. I've been providing home-based medical care in rural Hokkaido. I've been present at the final moments of many people. There are scenes I've witnessed there. The family is crying by the bedside saying, "Doctor, he was so full of life and it all happened so quickly." I wish I had talked about it sooner. I wanted to say thank you one last time. This regret doesn't happen because of a lack of knowledge, but because there was no opportunity to talk. In fact, in the earlier survey, the #1 reason people haven't talked about end-of-life medical care is because they never had a chance to start the conversation. Many people believe they must be mentally prepared for the end of their life. Well, they think about it, but they just can't take the first step. Today I'm going to talk in hopes that this class will be a starting point for you. Let me briefly return to the story about the fisherman I mentioned earlier. He was a fisherman in his 80s whom I saw during home visits. He said, "I was a fisherman, so at the end of my life, I'm going to have a barbecue with the fish I caught. Of course, I'll have some beer too, and my grandchild loves the fish I grill. They're just so adorable, I can't believe it. That's the greatest happiness in my life right now." He used to say that when he was healthy. And as his strength gradually declined, he also spoke like this. "I think you understand, doctor, but I really want to spend my final days in the home I've lived in for so long. If possible, I'd also like to attend my grandchild's graduation. Doctor, I'm counting on you?" I still remember this person's story. In the medical field, questions like this are often exchanged. Do you want cardiopulmonary resuscitation? Do you want to be put on a ventilator? It's hard to answer when you're suddenly asked something like that, isn't it? Is my condition really that bad? Or what happens if I'm put on a ventilator? Those words sound so impersonal and very cold. But, as the fisherman said earlier, wanting to see your grandchild's graduation or wanting to spend your final days in the home you've grown used to, if you have these two wishes, they're much more important for deciding treatment plans or for your family to care for you than just thinking about what treatments to do or not to do. So, what I want to talk about in this first part is not so much how to talk about death, but how to talk about how you want to live. Talking about how you want to die is really about how you want to live, right? So if you listen to today's video and think this is really important, please ask your family, what makes you happiest right now? Or what do you enjoy doing the most? Or, when your body gets weaker in the future, how would you like to live? How about changing the conversation from how you want to die to how you want to live and asking them that way? And after talking about those things, it's important to know what kind of signs appear in the final stage of life before someone passes away. That way you can be prepared and not panic when the time comes. It's also important to understand how to provide care. So in the second part, I'll talk about the 6 signs that appear before someone passes away and how family members can respond to them. Just by knowing this information, you won't panic and you won't blame yourself. And I believe it greatly increases the chances of having a peaceful final moment. Please watch until the end. The first of the 6 signs right before passing away is swelling. Actually, as a sign right before passing away, the body loses the ability to process fluids, leading to a loss of appetite and the inability to take in water. This is actually a natural reaction, and as we approach the end of life, our metabolism gradually slows down. The body understands this, and naturally, the amount of food and water intake decreases. However, it's only natural for family members to feel anxious, right? If their loved one can't drink water anymore, they might worry that they will pass away sooner. Because of this, they may try very hard to get them to drink water. However, in some cases, if the body can't process it, if they take in too much water, it often shows up as swelling in the legs or torso. And in medical settings, it's common for family members to have these kinds of hopes or questions. Doctor, since they can't take in fluids anymore, we want you to start an IV drip. Since they can't drink water anymore, at least give them nutrition through an IV. Will they die from dehydration if things stay like this? I completely understand how you feel when you ask these kinds of questions. Wanting at least an IV drip is a natural expression of your family's love. However, there is one thing I want you to know in the terminal stage. If too much IV fluid is given before passing away, it can actually cause more suffering for the person. This is not just my personal opinion, it is also stated in the guidelines of the Japanese Society for Palliative Medicine. In a study involving terminal cancer patients, 1,000 ml per day, they compared a group that received more than 1 liter of IV fluids with a group that received limited IV fluids. As a result, the group that received IV fluids reported the following symptoms. In the IV group, 57% had worsening swelling, compared with 33% in the non-IV group. In the IV group, 41% had increased phlegm or airway secretions, compared with 19% in the non-IV group. In the IV group, 34% had increased abdominal fluid, called ascites, compared with 14% in the non-IV group. In other words, if you give too much IV fluid, water accumulates in the body, and the hands, feet, and face become swollen. Phlegm gets stuck in the throat, causing a rattling breath and making it hard to breathe. Water accumulates in the abdomen, making it difficult to breathe. It could actually make the person suffer even more. But if they don't drink water, won't they end up passing away sooner? That's what you might think, right? It's not so much that they die because they can't drink water, but rather they're already nearing the end of life, which is why they can't drink water anymore. Their body can no longer metabolize it. So the order is actually the other way around, and also just like how flowers wither, and just as animals in nature don't get IV drips, all living creatures become dehydrated in the final stage of life. In fact, there are even studies suggesting that this state of dehydration may actually help ease their suffering. When the body is dehydrated, a substance called ketone bodies increases inside the body. Along with this, it's been shown in animal experiments that substances with pain-relieving effects are released in the brain. That's why in hospice care around the world and in end-of-life care, there are many reports that people who are slightly dehydrated tend to pass away more peacefully. Of course, this doesn't mean you should absolutely never use IV drips. That's not what I'm trying to say. Depending on the person's condition, of course, a small amount of IV fluids may be given to help relieve dryness in the mouth. What's important is not that everyone should have an IV drip, or that no one should, but rather to know that there is an option to adjust the amount of IV fluids according to the person's physical condition. The 6 signs right before death. The second one is this: changes in breathing. As a person approaches death, the muscles used for breathing gradually become harder to move. When that happens, this kind of breathing starts to appear. After taking a deep breath, the next breath is shallow, the breathing slows down, and then there are a few seconds where breathing stops, and then they take another deep breath in and out. The breathing tends to develop a wave-like rhythm. It feels like they alternate between taking deep breaths and then not breathing at all. And as the end gets closer, they start moving their mouth as if gasping for air, but they're not able to breathe in properly. Their breathing changes like that. Medically, this is called mandibular breathing because they move their lower jaw as if to breathe, which is why it's called that. And that's not all. Right before death, there's something called the death rattle, where you might hear a rattling or gurgling sound deep in the throat. My dad looks like he's suffering. Please do something for him, doctor. I want you to suction his phlegm, nurse. Many families hold their loved one's hand tightly and hurriedly call for medical staff in situations like this. This is a natural reaction, of course. In fact, I believe it's the medical staff's job to explain things in advance so that families don't have to react this way. We know that most patients in a state called agonal breathing or death rattle are not actually suffering as much as they appear to be. There is an analysis that gathered research from around the world about the rattling breathing I mentioned earlier, conducted in 2023. The conclusion here is that there was no evidence found that using medication for death rattle actually improved the patient's symptoms. In other words, the rattling sound in the throat sounds to family members as if the patient is suffering a great deal. However, inside the body, endogenous opioids, often called the brain's natural narcotics, have already been released. The person themselves is often not suffering. In fact, when their bodily functions have declined to the point where they can no longer take deep breaths, they can't expel carbon dioxide from their body, so it starts to build up. This condition is called narcosis, and it's said that the person falls into a very deep sleep and does not feel any distress in that state. So if you ever find yourself in such a situation, there's no need to panic. You can gently hold their hand, rub their body, and remember that their hearing often remains until the end. Please speak to them. Of course, if you feel anxious, you can always consult a doctor or nurse. Many people regret and blame themselves for the care they provided simply because they didn't know these facts. Please make sure to know this. The third of the 6 signs that appear just before death is a change in consciousness. As a person approaches the end of their life, their consciousness gradually fades. Even if you call out to them, they don't open their eyes or respond. Even if you call their name, they don't look at you. You might believe they can't hear you and talking is pointless, or feel you should leave them alone since there's nothing else you can do. However, this way of thinking has been clearly disproven by recent research. A study conducted at the University of British Columbia in Canada was the first in the world to scientifically report a shocking fact. For those who are approaching the end, they attached 64 electrodes to their heads and measured their brain waves. Then they had them listen to various sounds and observe the changes in their brain waves. As a result, they found that the brain was still responding clearly to sounds even just a few hours before death. Moreover, the responses followed almost the same pattern as those of young and healthy people. In other words, this is what it means. The person can no longer respond and they can't open their eyes anymore. You can't see any response, but there's a possibility they can still hear. It's very likely that your voice is reaching them until the very end. So please, even if they don't respond when you call out to them, don't stop talking to them. Thank you, I had a great time. I was happy because of you. Those words are reaching them until the very end. Whether you know this or not, I think it will change the regrets you carry about being there at the end. If you think this is important, I would be happy if you could share it with your family and others. The 6 signs that appeared just before death. The 4th one is what's often called an end-of-life vision. The 4th sign is a bit of a mysterious story. As the end approaches, the person themselves may say things like this: "My father is right over there. My grandmother has come from the afterlife to welcome me. There's a person in white standing there." This is commonly referred to as an end-of-life vision. Mom, don't say strange things. Get a hold of yourself. Has she lost her mind? Has the dementia gotten worse at this point? It might be natural to think that, but this isn't dementia. It's actually a significant phenomenon that can occur before someone passes away. According to the latest review compiled from global research and analyzed between 2024 and 2025, it's said that about 30% to 90% of people in the terminal stage have end-of-life visions. Often, this experience can be a source of comfort for the person themselves. Please think about it. On the final journey of life, a loved one who has already gone ahead comes to welcome you. This might actually be reassuring for the person themselves. So if they talk about seeing someone coming to welcome them, please don't deny it. Please don't laugh at them. Yes, just accept it. Say something like, "Oh, they came for you. That's wonderful. Your father came to welcome you." Just accept it as it is and hold their hand and stay by their side. That might be the most important care for them. When someone is passing away, the 6 signs right before death. The 5th one is this: temporary recovery. The 5th sign is something that, if you don't know about it, you might get too happy. Someone who has been barely conscious for a long time suddenly opens their eyes one day. They call out their family members' names. They even eat food. They even crack jokes. This is called temporary recovery. You might think, was the doctor's diagnosis wrong? Maybe they've recovered. Maybe they can hang on a bit longer. It's a moment when hope suddenly swells up. However, this phenomenon, according to research in the United States, it's said that about 70% of healthcare professionals have witnessed or experienced this phenomenon in clinical settings. And unfortunately, this phenomenon called temporary recovery is not a sign of recovery. It's actually a limited amount of time, like a final gift. This temporary recovery is a transient phenomenon and doesn't last long. So if that moment comes, don't get overly excited, but cherish that time more than anything else. Say the thank you you've always wanted to say, listen to the stories you wanted to hear one more time, take a picture of their smile. That might be the last chance given to you by God. The 6 signs right before someone passes away. Here's the 6th one. Restlessness. The last thing I want to talk about is something that isn't often talked about. That is restlessness. They might pull at the bedding or move their legs restlessly. They try to get up or seem restless no matter where they are. It's like they want to express something, but can't quite do it. People may say, stay still, don't move. It's dangerous, calm down. Sometimes you even have to restrain them to prevent a dangerous situation. But this is also a unique sign that tends to occur in the terminal stage. It's not happening because your care is bad. There's an indescribable discomfort inside the body that continues, but they can't put it into words. That's why their body moves on its own. This might be a silent SOS sign from the person themselves, gently stroking them, staying by their side, or helping them find a comfortable position. And if they seem very anxious or you don't know how to respond, please don't hesitate to rely on medical professionals. There may also be times when they are experiencing strong pain. Sometimes medication may be adjusted to help them sleep better at night, and using a medicine called a steroid medication can also help them feel more comfortable. This depends on the condition, so please feel free to consult with us. Now here's the summary of the second session. First point. Request for IV drips. Too much can have the opposite effect. Discuss the amount with your primary doctor. Second, changes in breathing. The patient is not suffering as much as it may appear. Hold their hand. Third, changes in consciousness. Hearing may remain until the end, so please continue to talk to them. Fourth, the phenomenon of seeing loved ones before passing. Accept it without dismissing it. Fifth, temporary recovery. Cherish this time as a final gift. Sixth, severe restlessness or intense unease. It may be a sign of discomfort or pain. Stay by their side and feel free to consult with us at any time. What all 6 have in common is that, as a natural reaction, families often become flustered. However, just knowing what we talked about today can change how you respond. The final moments may become much more peaceful, and your regrets may be eased a little. And now, here comes the important message. Up until now, we've talked about the 6 signs that appear just before someone passes away. I've talked about these things, but whether this kind of care was really okay, whether this kind of ending was really okay, easing these kinds of regrets. Just taking care of the 6 signs I mentioned isn't enough. What isn't reflected in those 6 signs is the person's own wishes, right? Where do they want to spend their final moments? Do they just want their pain taken away? What do they want to eat? It's really important to talk about these things while the person is still well. As I mentioned earlier, about 70% of people in the terminal stage are no longer able to express their own wishes. That's why it's important to talk about end-of-life care and medical treatment while you're still healthy. The government is also encouraging everyone to have these discussions, calling it advanced care planning. However, when people hear advanced care planning, it tends to become a gloomy conversation. Discussing choices like life-prolonging treatment or being put on a ventilator can be hard, can't it? If someone asks, "Mom, what do you want to do about a ventilator if something happens?" You might think, huh? Am I really in such a bad situation? That's how you'd feel, right? Talking about these what-if situations can sometimes end up hurting people. If you force the issue, it could end up making your relationship worse. So what should you do? There's one question I value most when talking with patients in my clinic. That question is, when do you feel happy? That's all there is to it. One patient answered like this: when I'm drinking my favorite sake and when I see my grandchild once a month. What do you think? Even with words like these, don't you start to see a bit of that person's life? Before talking about death, let's talk about life. How you want to die is, in other words, how you want to live. This is a very important question that I found while being with many people at the end of their lives. Some people value spending monthly time with their grandchildren above everything else. If your care goal is to spend time with grandchildren, but the hospital only allows 30 minutes of visiting, you barely see them. In that case, staying home may be better. Or if pain relief is the priority, if you feel more at ease having doctors and nurses around you, then maybe staying in the hospital would be better. Deciding on medical care based on what the person truly wants makes it much easier to determine the best approach for the final stage of life. And there's one more important thing. In this advanced care planning conversation, there is no single correct answer, and people's wishes can change. It's natural for someone who said they absolutely didn't want life-prolonging measures when they were young to say in their 80s that they want to live a little longer. That's why an advanced care planning conversation isn't something you do just once, and then it's over. It's important to have these conversations regularly, over and over again. The goal isn't to make a decision, but rather, the process of having these discussions itself is meaningful. That's the purpose. But if you suddenly bring up an end-of-life conversation, I think many people watching this video understand its importance, but still wonder when is the right time to bring it up. If you ask questions at the right time, you can naturally hear what the person is thinking. For example, when a family member is admitted to or discharged from the hospital, you can ask, what would you have done in that situation? Or when a family member celebrates a birthday, you can ask, how long do you want to live? If a family member refuses to get a health checkup and says they don't want to do it anymore, you can ask, why do you feel that way? By pausing and asking questions at these moments, their values will naturally come out. If you were asked these kinds of questions, how would you want to live your life? Please let us know in the comments. Seeing the different lives of various people can also give those watching this video a chance to reflect on their own lives. And watching this video might also be a really good time. While sharing this video, you could say something like, I saw this video, what do you think, Dad? Or, I've been thinking about things like this lately, what about you? Just that is enough. If you feel like you can't think about it right now, that's one answer too. There's no need to force yourself to decide. So here's today's summary. There are 6 things that families should know before someone passes away. Preferences about IV fluids, changes in breathing, and changes in consciousness. End-of-life visions, temporary recovery, and restlessness. These kinds of things often leave families feeling confused. With the right knowledge, you can face the end peacefully without blaming yourself. Lastly, I want to share with you the words I always tell my patients and remind myself of as well. Illness is only a part of life. Life is not defined by its final moments. It's made up of the small, everyday moments we accumulate. Having tea with your family, laughing together, arguing, and making up, each of those moments is already a wonderful conversation about how to live. Please let me know in the comments at the end, what are the moments when you feel happy? Whether it's when you're drinking coffee in the morning, eating cake, or taking a walk, anything is fine. Please share with us. If the comment section of YouTube Ilaudagea is filled with everyone's happy moments, just looking at the comments will become something to look forward to. I hope this channel becomes like that. Thanks for watching till the end. We are offering a free 1-page PDF summary of today's lesson through our official Line account. Finally, I made a checklist for a peaceful farewell, signs that appear before passing away, what the family can do at that time, and things you want to talk about with your family. I have summarized these sample questions in a 1-page handout. Please register with the official Line in the description box and type Yasuraka in hiragana, 4 characters. We will send it to you for free right away. Well then, today's lesson is over. Thank you for watching. See you again in the next video. As a general practitioner, my patients taught me how to age well after 70. I want to live this way too. I never knew it was possible. These stories share what I've learned. Is socializing more important than exercise? With medications, less is often more. These are lessons from my older patients. It's full of advice for living healthily and happily at any age. Check it out in the description below.